Welcome back. Well, it seems that the service delivery crisis in parts of the Eastern Cape could now be getting worse. There's a strike by municipal workers in some areas, particularly the Raymond Mhlaba municipality. Also reported students at the Fort Hare University are suffering as a result of this as well. On top of all of this, of course, this is on top of the drought in Dr Imtiaaz Sooliman is the founder of the organisation Gift of the Givers, doing so much to help people in the Eastern Cape. Dr Sooliman, good afternoon to you. What's the situation? What kind of problems are you dealing with there?
Good afternoon, Mr. Stephen. We always know there's problems when we start getting calls from municipalities, from mayors, from councillors, from hospitals and from schools. And from Friday, we've been getting calls to say they need increased water. And we were finding it a bit difficult to understand because we knew there was no water problems in Fort District Municipality. And Raymond Mhlaba is also associated with that. And then yesterday, in fact, one of my team members told me on Tuesday, his family member told him, is today a working day or a public holiday? Because your phone is going crazy the whole day. And he also couldn't understand. And then we checked. The calls were pouring in from CEOs of hospitals, actually crying. And of course schools were closed on Tuesday, but mostly from clinics and hospitals on Tuesday saying, we can't see our patients, we don't have water for drinking, we don't have water for theatre, we don't have water for linen, we're trying to borrow linen from other hospitals, but they don't want it back soiled. They want us to at least wash it and soak it, and then send it back. And they said, we can't do this. We're looking for extra linen, and we said, how much extra linen do you need and how long that's going to last for? And then the story came that there's a strike by municipal workers. So in some places there's vandalism of water supply, and other places where water is normally delivered to these institutions by water tankers is not happening. And then they tried to get water tankers from public works and other departments. Initially it was stopped, but thereafter there was an agreement to allow those water tankers to go through. And in the last 24 hours, it's just non-stop calls from everywhere. You can't be in all the places at the same time. It's just not possible. Because to fill a water tanker, to drive a heavy tanker across the road takes time. It's schools, it's hospitals, it's communities, everybody calling. And at night, it's so pathetic, it's so sad. When the tanker comes, you can see the desperation of people running to the tanker, trying to outrun each other, just so desperate to get one bucket of water.
It's unbelievable that this has happened. I mean, do we know why suddenly there's a strike on top of all of the other problems? I mean, the people really sabotaging water supplies.
That's what we are. Right now, one of our trucks is stuck in Bedford. First of all, they don't want to deliver the water. Now there's two types of strikes. Apparently, one strike is the municipal workers' strike, and the second strike is the public striking against the municipal workers to say they're not getting water because of the municipal workers. So there's a double strike. And because of that, an area like Bedford is completely cut off, where water can't go in and trucks can't come out. But fortunately, in many of the other areas, there is no issue. By far and large, the strikes are not violent. Yes, they block some of the roads, but it's not violent. People come, they're just desperate. The hospitals are desperate. So you need all sources of water in every way. And to answer your question, it seems that the strike is about wages. And apparently it started 2 weeks ago, but it's spreading to many more districts or many more municipalities. The mayors themselves are calling us, and even the ward councillors are calling us. Last night, we received a letter from one of the ward councillors, and he said, please help me. We're going to have a major crisis in Fort Hare University, in Raymond Mhlaba district. 10,000 students are affected. They're already having dehydration, they're already having diarrhea, and we're afraid that infection is going to spread to all 10,000 students and the people around them simply because there is no water. And the same story that the hospital in Butterworth gave us is the same story that we're getting from other hospitals. No water, no procedures can't take place. We can't admit any more day patients. We can't bring them to the casualty or the outpatient to be seen unless we have water. So besides sending out our existing water tankers, we now bring in additional water tankers. Unfortunately, last year, because of the drought, we had drilled bores in many of the hospitals. And of course, we just suddenly got feedback that some of the bores were not working properly. And we sent in teams, and we repaired those bores already. So hopefully, there'll be much more supply specifically for the hospitals.
It's such a difficult and dangerous situation, Dr. Sooliman. I mean, I don't need to tell you that. You know that better than I do. Do we need some kind of national intervention here to end the strike, whether it's a union intervention, maybe it's a provincial intervention? I mean, the idea that people are blocking water supplies is just amazing to me.
Stephen, it's absolutely frightening that there's been no intervention from national or provincial government. It's always creating the impression that this country there's no government in this country. It's totally leaderless. When you have a situation like this, you don't allow it to unravel over 2 weeks. People can die. There's thirst, there's infection, and then it just complicates the conditions. If you have one person being infected and then 10 and 100 and 1,000, the health system is already collapsing in the Eastern Cape. They have deficits of budgets, 4.4 billion just in litigation carried over from the past. They don't have money for food in the hospitals. They don't have money for soap for the medical staff and personnel. This is going to create an additional burden where more sick people are going to come. And now some of the hospitals are trying, the CEOs are trying really, really hard to move patients who are critically ill to hospitals that are less compromised, meaning they may have their own water supply and meaning they may have medical personnel to take care of these critically ill patients. But that's a cost, again, of moving people. So you would think by now, 2 weeks into the system, the crisis is so big, there should have been a visit by somebody from national, from provincial, from, calling in unions, calling in the Kochta, but it seems like nothing has happened.
Okay, so we need that kind of intervention. You've also been digging boreholes in Gqeberha because of the water crisis there. We know that in our country, cities get a lot more attention. Suddenly, there are so many demands on you. I can't imagine that you're able to help everyone who needs it at the moment.
No, it's not possible. Even under normal circumstances, it's not possible to help everyone. But every person we help, we make a difference. So right now, we're running several parallel programs. The one is, of course, Gqeberha, where the bore drilling is continuing. I think we've already added close to 10 million liters per day into the system. Our teams are working flat out in that area. And, of course, a lot of areas are now getting water from our bores, which takes a lot of pressure off the city. In fact, we had to divert one of those water tankers, unfortunately, to the Amatola district municipality to help the people there with more water. And that's the second area we're involved in. Oh, the other thing is, the train that comes, the health train that comes at Pepper, it's called, the train that comes has threatened that by tomorrow, if there's no water, the train is going to leave, which is going to be a huge loss to poor people in that area who are dependent on this train for many type of medical facilities. We've taken them water. We've given them JoJo tanks. We're trying to speed our water delivery to the JoJo tanks. And we're even trying to speak to the managers to say, please, don't take this train away. It's a lifeline for many patients in the area. It's parked off in Fort Beaufort at the moment. And we're trying to say, please don't go away. We'll assist as best we can. It's going to be a major loss in terms of health if that train decides to leave tomorrow. If Transnet, is involved with this program, it's going to be a huge loss. So we're trying to support that train to make sure it doesn't leave. Then it's going to be a huge loss to those patients medically. Then also, we're providing linen, pillowcases to the hospital to say, whilst you're busy having a problem, we're busy connecting 2 boreholes in Butterworth Hospital, and we're hoping by this evening or early tomorrow morning, we'll be able to pump a lot of water into the laundry, which will then solve that problem of the linen, and so that hospital can function fully. Fort Beaufort, we fixed the borehole. Tafelo Fefe, we fixed the borehole. Kala, we fixed the borehole. And the other areas, the boreholes are working. And then, of course, the additional water tankers we're bringing, and the other areas we're busy involved with right now, there's a huge malnutrition crisis in the Eastern Cape. Hundreds of kids are dying weekly from hunger. And we're busy with a 25 million rand rollout program with a fortified food product called Easy Peanut Paste that's been pushed out, aggressively to all the hospitals and clinics. So all that now is being disrupted because our teams have to focus on delivering water.
Dr Imtiaaz Sooliman, thank you so much. Really do appreciate that update. It's a very, very difficult situation developing in the Eastern Cape.